Welcome, good everyone, and good afternoon. Uh, Thank you for joining us on our third webinar on osteoporosis, living safe and aging well with osteoporosis. NBCA would like to thank Amgen for sponsoring this webinar. Our presenter today is Ms. Keisha Lewis. Ms. Lewis is a practicing occupational therapist and a certified diabetes care and education specialist with more than 17 years of experience working in the fields of human services, mental health, and physical disability. She serves as a consultant with the Health and Wellness Program for the National Caucus and Center on Black Aging. In 2019, Ms. Lewis co-founded Weldom LLC, an aging in place consultancy. Ms. Lewis's ultimate focus is empowering individuals with the skills they need to be independent in their environment without fear. Keisha, as I call you, thank you and welcome once again. We are looking forward to this webinar. Thank you.
Thank you, Ms. Telesford. So I'll go ahead and get started with our series on osteoporosis and living safe and aging well. So our objectives for today is we're going to increase our awareness of osteoporosis in the Black community. We're going to look to gain some insight about risk factors associated with osteoporosis, identify some proper nutrition guidelines, talk about some physical activity and identify physical activity that you can do. We're going to discuss the role of proper body mechanics and posture. We're going to discuss the role of balance and fall prevention, and we're going to make some action plans to move forward if you or a loved one has been diagnosed with or is at risk for osteoporosis. And we're going to identify some resources available to help you maintain good health. So we're going to do a quick review. If you weren't able to join us for our first or second series of the webinar, we're going to just talk about what osteoporosis is. So osteoporosis is a chronic condition and it can cause pain and debility. It makes it challenging for older adults to perform everyday activities. So essentially your bone is becoming weak and fragile with osteoporosis, and this can lead to bones that eventually easily break. And so there's a picture there that shows you what normal bone looks like, and then a bone that has osteoporosis, in which you'll see those larger forms of like circles that kind of look like honeycombs. So the bone is becoming fragile and weak there. So osteoporosis in the Black community and why this is important. The first misconception I'll say is that osteoporosis is a disease of older white women, and that's not true. Although we know that older white women more frequently get diagnosed with osteoporosis, osteoporosis is actually often seen in men. It can occur at any age, so men and women. And research has indicated that white women, they have higher rates of hip fracture. However, Black women have poor outcomes and higher morbidity and death related to hip fractures. So what we also know is that there are disparities that exist among racial and ethnic groups with osteoporosis, and that those disparities mainly involve the diagnosis and the screening and treatment of osteoporosis in the Black community. An example I can give you is that Black women, on average, they experience a 49 to 225% higher debility rate. And so that equates to long-term nursing home placement. And then they become Medicaid dependent more often than non-Hispanic white women 1 year post-fracture. It's also important to note that without proper intervention for fractures, spinal deformity and loss of mobility and chronic pain can result. This is just a graphic that I want to share with you. So in 2021, the National Caucus and Center on Black Aging Incorporated partnered with the Bone Health and Osteoporosis Foundation. And the infographic that you see there was created in which we highlighted some of the disparities in osteoporosis screening. I'd like to note that when it comes to the Black community, 8 to 10% are less likely to get screened for osteoporosis, depending on their age. And therefore, osteoporosis is more likely to get underdiagnosed or undiagnosed. And Black women are often less likely to receive medication to treat osteoporosis and prevent fractures. And so these are just some of the highlights. And this infographic, it can be accessed through the Bone Health and Osteoporosis Foundation. Another thing is women in the Black community, they tend to have less awareness about osteoporosis than white women. And this can often delay or prevent treatment. So that's why it's so important that NCBA is presenting this webinar and engaging the community and educating you about osteoporosis. So a little bit about the impact of fractures. So what does it mean if you have a fracture? So fractures most often associated with osteoporosis are going to be your hip fractures, spine fractures, and wrist fractures. And so we are going to see here that non-Hispanic Black women have been shown on average, as I mentioned, to have a 49 to 225% higher debility after suffering a hip fracture. So you see that 33% are more dependent or in a nursing home in the year following a hip fracture. We also see that the mortality rate for hip fractures is different in non-Hispanic Black men and women. So they have a higher mortality rate following a hip fracture than their non-Hispanic white counterparts. And other things is osteoporotic fractures, they're preventable, and osteoporosis is treatable. And that's the big thing I want you to take away from that. So as to review who should be screened for osteoporosis. So in the first and second webinar series, we discussed this, but any person who sustained a hip or clinical vertebral fracture, so in their spine, women over 65, men over age 70, individuals over the age of 50 with risk factors such as frequent falls, low BMI, so low body mass index, low calcium intake, and vitamin D insufficiency. And then women who are postmenopausal under the age of 65 with risk factors. And these risk factors, the first four are risk factors and recommendations from the National Osteoporosis Foundation. And then the bullet under that is actually from the U.S. Preventative Services Task Force. So I just wanted to point that out. So now we're going to talk about what is the proper screening for osteoporosis. So osteoporosis screening is actually done by a bone density test, and this is called the DXA scan. DXA scans can better predict DXA scans. They're preventative scans, and they're considered the gold standard in determining bone density levels. So it's used as both a screening tool and a diagnostics tool. In the scan, it measures the bone mineral content and the bone mass, and it's able to detect the depletion of calcium and protein in the bone. And this depletion puts you more at risk of fractures. DXA scans are incredibly effective, and they show a more detailed image of bones than standard x-rays. But I will let you know there are some disparities that exist in the testing and the access to these DXA scans for osteoporosis screening. So if you meet those qualifications, I encourage you to speak to your doctor about receiving that. So what do we need to do? We need to take some action. And this is what we're going to learn about today, is what are the things that we can do to take action? So we're going to first talk about proper nutrition. So Black Americans may be at an increased risk for osteoporosis due to lack of calcium and vitamin D. And so what we know is inadequate nutrition is a major risk factor for osteoporosis. It's important to remember that bone is a living tissue. And so nutrients serve as an important part of maintaining good bone health. Inadequate nutrition can lead to a significant loss of bone and place individuals at risk for a fracture. So now we're going to get a little bit more about calcium, and we're going to talk about it more on the next slide as well. But calcium, if the body's not getting enough calcium through the diet, it begins taking calcium from the bones to help serve the functions of the body that's needed. And this can result in a negative calcium balance, which is not good for bone health. So calcium is necessary for normal bone development. Okay, and calcium is best absorbed through calcium-rich foods, in which we're going to discuss in the next slide. But many Black American women may be at increased risk for osteoporosis because they consume less calcium than the recommended dietary allowance. So I want you to think about it. And if you feel like you're not getting enough calcium, you may need to speak to your doctor and consider a calcium supplement. And what I'd also like to know is that milk and dairy products are excellent sources of calcium, but about 75% of Black Americans are lactose intolerant, which leads to that decreased intake of calcium. So this can prevent us from getting the correct amount of calcium. And so, in fact, we also need not just calcium, but vitamin D, in which we will talk about as well. And I will say again about the lactose intolerant, because we're more prone to being lactose intolerant than any other group, this can hinder our optimal calcium intake. And we tend to avoid milk and other dairy products because we have a hard time digesting those products. So a little bit more about calcium and Black Americans. So Black Americans and calcium. So many Black American women, just as we talked about, are more at risk for consuming less calcium than that recommended dietary allowance. And we also know that calcium is necessary for normal bone growth. So as I mentioned in the previous slide, if the body is not getting enough calcium through diet, it begins to take that calcium from bones and serves other functions. So we're going to look at how can we actually get more calcium. So some of our calcium-rich foods, and I'm sorry, I just noticed the typo there. I have calcium rice foods, but our calcium-rich foods, dietary sources. So dairy, as I mentioned, examples are cheese, yogurt, and milk. We get calcium from fish, such as sardines or canned salmon, beans, lima beans, kidney beans, our nuts. So your almonds are a good source of calcium. Certain dark leafy green vegetables like collard greens, spinach, kale, and then fortified foods such as your bread, your cereal, and your soy products. So consuming 3 servings of dairy or other calcium-rich foods a day is the recommendation. And so we're going to talk about maybe what that looks like. And I'll just give you an example. Sardines, that's pictured here, it has about 325 milligrams of calcium. The cup of collard greens, for example, has about 357 milligrams of calcium. And be mindful of not overcooking the greens so that you get the optimal amount of calcium from them. A cup of lentils, for example, has about 65 milligrams of calcium. For someone that does not eat meat and they're looking for more plant-based, tofu is also an option, and tofu has about 176 milligrams of sodium. So if you say, okay, well, that's how much sodium is in each of these foods, am I getting enough calcium? Excuse me, I said sodium. Is calcium, do I have enough calcium in these foods? So how do you know if you're getting enough? So let's take a look. So the recommended dietary allowance for adults. So for those of you that are on the call or on the Zoom and you're between the ages of, I'm going to jump to 19 to 50. The recommended dietary allowance is about 1,000 milligrams a day. If you're between 51 and 70, that's also 1,000 milligrams a day. And you see you have a recommended dietary allowance, and then you have an upper limit, and that's just the maximum amount that you should intake. And then you see in women, and I did not list men there, But in women, you see it's, again, 19 to 50 years of age, about 1,000 milligrams. And in women that are 51 and older, about 1,200 milligrams. So remember, if you don't think you're consuming that through the food that you're eating, a calcium supplement that contains vitamin D might be an option that you discuss with your physician. And it's important to note that your body needs to be able to absorb calcium for it to be effective. And so sometimes when we put calcium with vitamin D, that helps with the absorption. And so we'll talk about that a little bit more when we talk about vitamin D. So remember, I mentioned that many Black Americans are lactose intolerant. So I don't want you to think that, because sometimes we do think that, milk, so dairy products are the only way to get our calcium, and that's not true. So I did some options here of what you could do to increase your calcium. So if you eat oatmeal and you're lactose intolerant, you can add some almond milk to your oatmeal. Remember, almond milk, it has some calcium, because remember, almonds have calcium, and you turn that into milk and it does have calcium. And sometimes you'd be surprised. When I was actually doing this, I looked at the label and I saw that depending on what type of milk you have in your fridge, your dairy milk compared to your almond milk, it's about the same amount of calcium in them. Another thing that you could do, you could eat sardines for a mid-morning or afternoon snack. You could add calcium-rich greens like your collards, turnips, kale to dinner meals a couple of times a week. You can eat low-fat or fat-free yogurt with fruit for breakfast or snack. You can eat almonds for an evening meal to get in some extra calcium. You can make a salad and you can add those calcium-rich veggies like broccoli and avocado, artichokes, onions, and spinach. Those are all great ways to get some extra calcium. So we'll move to the next slide and we're going to talk about vitamin D. So with vitamin D, what we know as we age, the skin's ability to absorb vitamin D declines. So in addition to that, older adults are likely to spend more time than younger people indoors. And so this might affect their intake of vitamin D. And another thing with Black Americans, our skin pigmentation, it can determine our amount of exposure to the sun. So as a Black American and having darker pigmented skin, my body might be less likely to absorb the vitamin D. And so we're going to talk about that more, but vitamin D is the sunshine vitamin, and it helps proper function of our nerves and our muscles and our immune system. And so all of that is very important to our bone health. And we're going to talk about that a little bit more. So I think in one of the slides, I might have a picture of a bottle of vitamin D. And so we'll talk about that. So how do you increase your vitamin D? So definitely through sunshine, but I want you to remember you need to avoid extended exposure to sunlight without proper sunscreen. And I want you to remember that when you're out in the sun, your body starts to convert that sunlight into vitamin D after it hits your skin. So about 10 to 15 minutes outdoor with direct sun on your hands, arms, and face 2 or 3 times a week will give your body some of the vitamin D that you need. If you're going to be outside for longer, remember you want to put some sunscreen on. And sunscreen can block the absorption of vitamin D, but you need that sunscreen if you're going to be outside for a prolonged period of time. Vitamin D supplements that you can take. Vitamin D intake should not exceed what we say 100 mcg or 100 micrograms, which equates to about 4,000 international units or IU in a day. Recommended daily amounts for adults 19 to 70 years old is 15 micrograms, so 600 IU international units. And then there's a different recommendation if you're over the age of 71, which is 20 micrograms or 800 IUs. So I would say I have low vitamin D levels. Spoke to my physician, and my physician actually prescribed me an over-the-counter vitamin D supplement. That's about, I think I take 2,000 IU, international units, a day. But other ways I try to get the vitamin D in is dietary sources like the fatty fish, salmon, trout, tuna, beef liver, I don't eat, but that's an option. And then egg yolks is also an option to get in some vitamin D. But don't go out and just start taking vitamin D if you're not vitamin D deficient. You need to speak to your doctor about what supplement you should take. But I will note that most Black Americans are vitamin D deficient. So here's my little screenshot of some vitamin D tablets here. And so you increase your vitamin D, remember, through sunshine and also through supplements. And so that little picture down there gives you some other options of dietary options as well as sunlight there. Another thing that I'll talk about that's a part of a healthy, balanced diet is protein. So if you're protein deficient, you can't build muscle, skin, or bones. And so you need protein to strengthen your muscles, your bones, and to have some stability. And so protein makes up about 50% of our volume of our bone. So adequate protein, particularly for seniors with osteoporosis, is important. And anyone that's at risk for malnutrition due to a chronic or acute illness or recovering from an injury also need protein. The U.S. Dietary Guidelines for Americans recommends consuming a mixed protein diet consisting of high quality animal and some plant-based foods. A balanced diet with sufficient protein intake, regardless if it's animal or plant, benefits bone health. And that's important when you couple that with good calcium intake. I will note that special high protein diets that have multiple servings of meat and protein with each meal should be cautioned. And I have the little asterisk there that you need to speak to your physician before you just simply increase your protein intake, okay? There's a lot of literature out there speaking to how complex protein is, but seniors that have kidney disease, they also have to be careful with the amount of protein that they intake. They shouldn't increase that protein unless they speak with their doctor. So that's why I said having a conversation with your doctor is important about the role of protein with your individual other health needs. So this is a great resource in which I'm going to ask Ms. Telesford to actually put in the chat so you can copy it or you can visit it yourself. But this is from the Bone Health and Osteoporosis Foundation. And it just is a resource on food and your bones. It talks about calcium-rich foods, bone health ingredients, talks about the plate guide method of having just a healthy, balanced plate. It talks about natural ways to build healthy bones. And so if you need some support in what to eat, how to eat, I would encourage you to view that site. Now we're going to move into exercise and osteoporosis. So I want you to remember, if you have osteoporosis and you're at high risk for falling, or if you're at high risk for having a fall, or a fracture, or you have any other medical condition affecting your ability to exercise, I want you to check with your healthcare provider, your healthcare team before you start an exercise program. But I do want you to know the benefits of regular exercise. So benefits of regular exercise include increasing your muscle strength, improving your balance, decreasing your risk of bone fracture, maintaining or improving your posture. And exercise can also relieve or decrease pain. One thing I'll note is that there was a study that I reviewed while I was preparing for this, and it was presented in an article by the International Osteoporosis Foundation, and it revealed that people with a sedentary lifestyle are more likely to have a hip fracture than those who are more active. So an example they provided was that women who sit for more than 9 hours a day are 50% more likely to have a hip fracture than those who sit for less than 6 hours a day. It also has been suggested that exercising prior to age of 40 is associated with a lower risk of falling when you become an older adult. So I want you to think about that. And so if you're someone who you have a lot of sitting and TV time or sitting and desk time, get up and move to reduce those risks of fracture later in life. So the first exercise we're going to talk about is weight-bearing exercises. So weight-bearing exercises are the focus for osteoporosis. And walking as little as 3 to 5 miles a week can help you build your bone health. So weight-bearing exercises are exercises that work directly on your bones and your legs and your lower spine. They can slow down mineral loss, and they can provide cardiovascular benefits as well. Some weight-bearing exercises that you can do is walking, jogging, and dancing. So some level of that is something that we all may be able to participate in. Another exercise is what we call strengthening exercises. So these exercises are like free weights, resistance bands, or using your own body weight to help strengthen all of your major muscle groups. Strengthening exercise help you maintain spinal muscles to maintain posture, so strengthening your spinal muscles. It also helps to maintain bone density and can reduce risk of fractures. So I will note here, those are some pictures and examples where wall push-ups, that's an example of using your own body weight for strengthening. And then bicep curls, that's an example of using those free weights. Other things I'll note is if you don't have free weights, you can use water bottles and canned goods to replace weights because other resistive exercises could be, lifting some objects that you have in your home other than the water bottles or the canned goods because these are still going to strengthen those bones. Other examples of strengthening exercises, there you see me doing a chair squat, and I'm using a chair to hold on to maintain balance. Toe raises, that's also another example of some strengthening exercises. The last category that we're going to discuss here is flexibility exercises. So moving your joints through their full range of motion helps you to keep your muscles working well. So stretches, I'd like to say they're best performed after your muscles are warmed up. So that could be at the end of your exercise session or maybe after a 10-minute warm up. Remember, stretching should be done gently and slowly without bouncing. Let's see what else I want to note here. You want to avoid stretches that flex your spine or cause you to bend at the waist because this could put you at risk for fracture. So I would suggest and recommend that you speak to your doctor and or your physical therapist or occupational therapist to see what stretching exercises are specifically best for you. So things to remember just from the exercise portion is if you have osteoporosis or at risk for osteoporosis, or if you have risk of falling, you want to be careful that you avoid high impact and fast moving exercises that could put you at risk for falling. If you are at risk for a fracture, you want to avoid jerky, rapid movements in general. And keeping bones, joints, and muscles healthy can ensure that you're able to complete your normal daily activities. So the next slide, I have this great resource. Again, I'm going to ask Ms. Telesfor to place this in the chat for you. But this is also another resource by the Bone Health and Osteoporosis Foundation, in which it's safe movement and exercise videos. It talks about non-impact exercises. It talks about proper body alignment, reducing falls. It gives you an activity plan for weekly workouts. And then it talks about 3 osteo-safe exercises for bone strengthening and balance. I would encourage you to visit that link and look at some of those exercises for yourself. And then this is another great resource. And this resource is just to highlight some weight-bearing activities. And it's giving recommendations of how often, how hard, and how much you should do. And this is through Exercise is Medicine. It's a document that you can also review, and Ms. Telesford could place that in the chat for you to click that link and save as well. So next we're going to move into some fall prevention. And we're going to talk about why your balance matters in osteoporosis prevention. So osteoporosis as we age. So as we age, we can experience more falls. So falls occur in approximately 1/3 of adults over the age of 65. And this risk increases with age. So in persons with osteoporosis, your bones become weaker, and even a minor fall can be dangerous and result in a fracture. And it's also important to note that as we age, our bone mass density declines with age. And so as we age, it's really important for physicians, occupational physical therapists to intervene with treatment to help prevent falls. Especially in persons that have osteoporosis. So if you're at risk for falling, in which the next slide, I'm gonna let you know how you can go check your risk for falling through a great tool that the National Council on Aging has. But common risk factors that place you at risk for falling is if you have visual loss, if you have a fear of falling, you're more likely to fall. If you have poor balance, muscle weakness, unstable blood pressures put you at risk for falling, poor sensation, and then certain medications that you take also could put you at risk for falling. Other things I'd like to know is some complications that we have with our health, like diabetes and associated nerve damage associated with diabetes could put us more at risk for falling. Again, as I mentioned, visual problems and problems with blood pressure can also increase your risk for falling. So your balance does matter. And balance exercises help us maintain balance when unexpected or unbalanced movement in our daily life occurs. However, when balance does become a challenge, you're more at risk for falling. So what I would encourage you to do, and I'm going to ask Ms. Telesford to drop this link in the chat as well, is take the free balance assessment to assess your fall risk. So the National Council on Aging does have this falls free checkup, and it's an online tool. At the end, if we have some time, maybe I'll click the link and you can see, but you go through and answer a series of questions, and it will give you a summary at the end to let you know if you are at risk for falling. And so speak to your physician, working with a physical or occupational therapist again for a detailed assessment of your needs is very important, okay? And then we talk about ways that you can actually prevent falls, okay? So these are some of the things that you can do at home. So, sometimes you have things that are environmental factors that, are surrounding your home or in your home. Sometimes you have physical risk factors associated with falls, and those are some of the things that you do. So I'm just going to mention some of these things about how to prevent falls. So you want to remove throw rugs and other items from the floor. You can use a non-skid floor mat or area rug. You want to remove that. Or you can use one that has skids on the back so you don't trip on them. You can install grab bars in the bathroom, install stair railings at the entrance of your home and inside your home. Make sure if you do have railings that those railings are sturdy. Ensure that you have proper lighting in your home so you can see where you're going, especially at night when you get up to go to the bathroom. Wear flat shoes with non-slip bottoms. You can use some type of assistive device if you have been identified or know you have poor balance. So a cane or walker, a raised toilet seat, a stair glide might be necessary. Be mindful of your environment. And what I mean by that is when you're walking around inside and outside your home, if you see a puddle of water, if it's cold and there's ice on the ground or snow, be mindful so you don't slip and fall. You want to keep your hands clutter-free. So when you're walking around the house, you're going up and down some stairs, being mindful of what you have in your hand, because if you tend to lose your balance, you use your hands to react. And if you have things in your hand or you can't see where you're going, this could impact you and cause you to fall. Also, if you have identified yourself or a loved one at risk for falls, you want to speak to your doctor about that and see what you can do about it. And then again, asking your doctor about a physical or occupational therapy services is also something important that you can do. So next, we're going to talk a little bit about posture. So poor posture can contribute to spinal deformities. And so postural changes may be associated with osteoporosis. Poor posture can be caused by pressure and affect different parts of your spine. And there are postural exercises that can help you stand straight and reduce pain and discomfort associated with osteoporosis and prevent spine fractures. So something that we'll talk about is good body mechanics, but actually lifting the wrong way, lifting something that's heavy, twisting and bending forward. Those are frequently or can be frequently the cause of fractures in our spine, or also known as vertebral fractures. So using proper body mechanics and safe body mechanics during all of our activities, it will protect our spine against injury. And postural exercises are something that you can do daily. In fact, I'm sitting in a chair right now in which when I started, it caused me to kind of lean back. So I put a pillow kind of in the lower half of my spine so I can sit upright more to be able to do this presentation. So when we talk about good body mechanics, you want to avoid exercises and daily activities which cause you to round your spine. So that could be leaning over to make a bed, getting groceries out of the trunk of the car, bending over to pick up an object off the floor. Now, these are activities that we have to do. Don't get me wrong. You can't just slip out of bed and not make your bed. But you want to be mindful of how you're doing that. So key points for posture is that you want to keep your back, your stomach, and your leg muscles strong and flexible. You don't want to slouch. You want to ask for help lifting heavy objects, and you want to maintain a regular exercise routine. That's all an important part of good posture and strengthening your core, as people always probably tell you to do. Other exercises to avoid is like sit-ups, crunches, bending down to tie your shoes, exercise machines that involve forward bending of your trunk, movement in sports that round and twist your spine. You have to be careful of those. Now, in the next couple of slides, I'm just going to share some photos with you that show you the postural do's and don'ts. So postural don't, you see me there, I'm working in the yard. And what you don't want to do is squat and round your back and, try to reach and dig in those plants. What's better is, we'll get to that slide, but you see me bend in there to water the plants. These are things you want to avoid that round and bend your spine and could throw your balance off. So next slide, you see me postural do's. There I'm on my knees on a little comfortable cushion, and I have my back straight, so my spine is straight, and I'm reaching into the plants to, I guess, pluck off some that are bad. There I'm using the one knee approach, in which I'm kneeling on something and I'm using my other leg to stabilize me, so I'm not leaning forward. There I'm squatting, but I have one foot firmly planted, the other one is there, and my back is upright. So those are good postural techniques that you can use. It helps you to keep your back, your stomach, and your leg muscles strong and flexible. So now I'm going to offer you some tips for daily living and lifting items. So when lifting items, it's important for you to know your strength and only lift what you can handle. You always want to lift by carrying the load close to your body and not far away. You want to make sure you're bending your knees and letting your legs do the work in lifting. You don't want to twist your back and turn with your feet. When we think about safe sitting, so I'm sitting now, you want to avoid low soft chairs that have poor back support. You want to use an upright, firm chair that does not allow your lower back to slouch. So remember, I told you earlier, I put a cushion back here, so I'm upright in the chair. You want to get up and straighten your back out at least every 30 minutes. If you've been sitting for over 30 minutes, you need to get up and you need to stretch. You need to stand. So if you've been sitting listening to me, stand and take a stretch break. I'll keep on talking, but you stand and you take a break. Other tips for daily living include when you're standing, you want to avoid bending forward. You want to have a working surface at a comfortable height. So if you're in the kitchen, you're doing a lot of activities there, make sure it's at a comfortable height for you so you're not reaching too far over or bending your spine. This is a good technique, one that I love for getting in and out of bed. It's important. Use a firm mattress that's going to give you more support. Technique for getting out of bed. Or getting in bed. I guess I'm going to read in and then I'll reverse it for out. But to get in the bed, some of us just sit, we jump in the bed or we just dive in. But think about this. If you were to and visualize it, so you might have to close your eyes if you're a visual person. But to get in bed, you're going to sit at the side of the bed. You're going to lower yourself onto your elbow. And then you're going to lower further onto your shoulder. You're going to bend your knees at the same time. You're going to draw your knees up until your legs are in the bed. Then you're going to roll your body and your knees together to face the ceiling. And then you're going to reverse this sequence when you're getting out of bed. So I'm in bed. I'm going to draw up my knees and roll my body and my knees together. Okay. And I'm facing the ceiling. Then I'm going to draw up my knees. Okay. And then I'm going to roll and get my legs out of bed. And then I'm going to use my shoulders, bending my knees at the same time. And I'm going to raise myself up on my elbows. And then I'm going to sit on the side of the bed. So it's really important that you do, especially if you're at risk of osteoporosis, you're at risk for a fracture. You want to move slowly versus rushing to get up, because that's when you're more likely to possibly have a fracture. So this is a great exercise guide. I like this. I talked about strengthening exercise. I talked about posture and balance. I talked about weight bearing exercises as well. So more in that aerobic physical activity. And this guide came from Osteoporosis Canada. They have this great guide called Too Fit to Fracture, and it's an exercise guide. If you are not one to exercise, you haven't been exercising and you want to use that guide, it's simple enough to follow. And so Ms. Tellisford, if you could drop that in the chat, that would be great as well. But it goes through how often you should exercise, how hard should it be, how long should it be. And so it's telling you there, your strengthening exercises you need to do at least twice a week. Posture exercise every day, because that's something really simple. Balance exercises are important to do every day. And then aerobic activity most days, so 5 or more days out of the week. Now I'm going to move into caregiver tips. I'm looking at my clock here to make sure I still have some time, and we do. So caregiver tips for someone that has osteoporosis. I would suggest that you seek out healthcare providers who have experience working with persons with osteoporosis. Again, here's a great resource that the Bone Health and Osteoporosis Foundation have on professional partners and networks on how to find a doctor. There's a couple of lists there and information specifically for caregivers there. And Ms. Tellisford, if I didn't send you that link, you can see it there, but I'll copy it and I will actually do it at the end. I'll send it. Okay, so as a caregiver, how can you help someone that has osteoporosis or is at risk for developing osteoporosis? You can assist them with management of what we call their ADLs, their activities of daily living, dressing, bathing, grooming skills. Or you can assist them with their IADLs, which are your instrumental activities of daily living. And those are the things like cooking, cleaning, gardening, everyday things that you do in your home. You can support them by encouraging healthy eating. So increasing calcium, increasing vitamin D, increasing protein in their diet if needed. You can encourage them to exercise, partner with them and be that exercise buddy. Encourage them to use medication if they've been prescribed medication for their osteoporosis. Have a conversation with them to discuss their risk for falling. And if needed, have a conversation and start that conversation with their doctor to encourage them to work with therapy. You can also reduce those personal and environmental risk factors associated with falling that we talked about in the things that you can do in your home, okay? And then treatment guidelines for osteoporosis. These were some of the things that were talked about in the second series of our webinar that I want to highlight again. So what you can do is help those that you care for follow these guidelines. So once osteoporosis is diagnosed, aggressive therapy is indicated. An article that I read entitled Racial Disparities in the Treatment of Osteoporosis, it found that after diagnosis, 80% of white women received pharmacotherapy, so medicine, after osteoporosis diagnosis, but only 68% of Black women did. So we need to advocate for that and advocate for research when it's available, which I'll talk about more. But treatment guidelines for osteoporosis include taking the medicine, so pharmacological treatment, making sure that we have calcium that's recommended, vitamin D that's recommended, make sure we exercise, and then make sure if we are at risk for falling that we get evaluated for our fall risk. So this is some things as a caregiver that you can encourage. And then our goals of medication management. So the goal of medication management is to slow down bone loss and help rebuild bone. So it's important to remember this will treat osteoporosis. It lowers the risk for fractures. And so the provider may also prescribe calcium and vitamin D supplements to complement medication. So in order to make medication work, remember, you have to take it as prescribed by your provider. And you need to make sure with any medication that you understand why you're taking it. How should you take it? What are the side effects? What's the proper storage? And then knowing what's the generic name versus the brand name, because oftentimes that could impact costs, okay? So your healthcare provider will work with you to keep track of your progress and perform periodic blood tests on your bone density and make sure that everything or treatment plan and medication is working as it should. The other important thing is understanding your insurance coverage. So we talked about this in the second series as well, but Medicare Part B, which is your medical insurance, it covers the DXA scan. And remember I said earlier, the DXA scan is the gold standard. So once every 24 months, and sometimes it can occur more often if medically necessary. And maybe if you meet one of the conditions listed below. But what I will say is there was an article that was published by Healthy Women, and it noted that Medicare beneficiaries who have a DXA bone density test, they suffer 35% fewer hip fractures and 22% fewer other fractures. So if you meet any of those criteria, I would encourage you, have a conversation with your doctor about getting that DXA scan completed. Many other insurance providers will cover the test under certain circumstances as part of their preventative screening. So if you're a woman younger than age 65 or a man younger than age 70 or any of the above conditions puts you at risk for osteoporosis, your insurance provider may cover that. With any one of these factors, your insurance company should cover the DXA. So be sure to check with your insurance provider if you have something other than Medicare. And if Ms. Telesford, if you could put the link here, this comes straight from the Medicare website on Medicare coverage for osteoporosis drugs, and it talks about the screening there. So as I work on closing here and we talk about policy actions, so policy actions and how to close the treatment gap, that's something that we need to do so that there's not this big disparity between Black adults that are at risk, develop trust in our at-risk populations, generate more data on minority patients in osteoporosis. We want to generate more information on the effectiveness and the safety of drugs. And we want to continue to have webinars and platforms like this to engage members of our minority community about bone health. We want to look at improving insurance coverage for fracture prevention services. continue to engage clinicians and increase their awareness about the needs for older Black Americans to be screened. And we want to connect with diverse communities and tailor education and communication to meet individual needs to enhance our impact of what we're doing clinically. And this is some other additional free resources after the webinar. If you reach out to NCBA, we can provide these resources as well as a PDF copy of the slides. And these are additional resources and additional references here. So it looks like, Ms. Telesport, I am done. And so I have a few minutes that I definitely can answer some questions.
Thank you, Keisha. Thank you for joining us for 3 segments and discussing osteoporosis. And we appreciate this conversation. And we also want to thank Amgen for their support of this robust conversation. We do have several questions in the chat, and we have 7 minutes. If we don't get to all of the questions, Keisha, will you answer those questions and we get back to the person who asked the question?
Yes, ma'am, I can do that.
All right, so I'm going to kick us off if that's okay. And the first question reads, is it possible to get too much calcium?
So it could be possible to get too much calcium. So what I'm going to do, and I am going to stop sharing just for a minute so I can actually find that slide and see if I had the upper limits listed there. But yes, so you should speak to your doctor. And there is a recommended dietary allowance, and then there's always going to be an upper limit for calcium. So the upper limit of calcium is what you don't want to exceed. And so I do have that slide up, and I was going to try to share it again if I could. Let's see, and here it is. So if you can still see that on the chart there, I had the recommended dietary allowance and then the upper limits. So on that upper limit there, depending on what age group you fall in, you wouldn't want to exceed like 2,000 milligrams of calcium a day. And so that would be if you took a supplement and you took multiple supplements, you don't want to exceed that. But speaking to your doctor about what's needed for you based on your age would also be important.
Okay, and so before I read our next question, I just want to reiterate, it's best for us to speak to our doctor about supplements, calcium and other supplements before we head to our local pharmacy and just buy a bunch of supplements, correct?
Correct.
Okay, all right. So our next question reads, when eating yogurt, does the percentage of fat in the yogurt matter in order to get enough calcium?
So I will say this presentation was about osteoporosis and the need for calcium, but some other health needs we have sometimes can impact our diet. So for the purpose of this webinar and calcium, we're looking at that yogurt from a calcium standpoint. But if you had other health conditions and I was concerned about your weight, or maybe I was concerned about blood sugars for diabetes management, I might say we have to look at that little container of yogurt in a different way. But the fat isn't going to impact your ability to absorb the calcium. I'll say that. But the fat in the yogurt could affect some other things. But don't worry about the percentage of fat for the purpose of eating that yogurt for calcium.
Okay, thank you, thank you. Our next question reads, should ladies stop carrying big handbags? Is it better for balance to carry a roller bag?
So a roller bag would be definitely a little better to protect your joints. I would say if you carry a handbag or shoulder bag, it's nothing wrong with that. You just want to make sure it's not overly heavy, excessively heavy. Especially if you're at risk for having a fracture. Because I think in the first webinar series, I talked about vertebral fractures and osteoporosis being like a silent disease. So you wouldn't want to put extra strain on your shoulder that then could cause some strain on your spine that could result in some type of fracture. But a handbag, a shoulder bag is okay. Just don't have it weighted down so it feels like bricks. But if you want to do a roller bag, that would be great as well. But I would caution the roller bag if you have any trouble with balance, because rolling a bag and maintain your balance could be a challenge for some people, but handbag is okay.
Okay, thank you. And we have time for 2 more questions. The next question asks, in terms of cardiovascular disease, can I ride my bike?
So yeah, you could definitely ride your bike. With osteoporosis, I would say, yes, you can ride your bike. You just want to make sure that you are someone that has good balance, because I wouldn't want you to have an injury and fall off your bike. I also encourage you to put on your helmet when you ride your bike. But riding a bike could be a great cardiovascular exercise.
Okay, thank you. Last question. Can medication taken for other illnesses cause bone loss?
So I'm not sure about all medications, but I will say all medications do have risk. And some medications could impact bone health and bone loss. And so I always say when you get a new medication, it's best for you to speak to your pharmacist to see what are the side effects, what are the risk factors associated with that. Because if you're already at risk for low bone density or low bone mass, so osteopenia, low bone mass, osteoporosis, low bone density, if you're at risk for those things already, I would think that your physician would really think about what medicine you're prescribed. If you're not at risk for those things, the physician might prescribe a medication that says, hey, you know what, these might be some of the risks. But I would just encourage you, always talk to your pharmacist, see what the risk factors are. If you're already at risk for osteoporosis or osteopenia, then go back to your doctor and say, hey, I'm at risk for osteoporosis, or I have osteoporosis, and I noticed that this medication said that a side effect is decreased bone loss. I'm a little concerned about that. So I would definitely speak to your doctor about that and your pharmacist.
Okay. And Keisha, we're going to sneak one more question in if it's okay with you.
Okay.
Okay. Last question. I know someone who lives alone in a home with lots of steps. Are there resources to assist this person?
Well, what I would do is I would reach out to your local area agency on aging. A lot of times there is some assistance available with home modifications. If the person is low income, they may qualify for some assistance by this organization called Rebuilding Together. They do some repairs for if you meet a certain income criteria, depending on where you are, if there's a local chapter of Rebuilding Together. But I definitely encourage you, reach out to the area agency on aging in your area and see what resources might be available, because possibly it's an opportunity to install a stair glide or install a more secure handrail for that individual.
Okay. Perfect. We are exactly at 2 o'clock and we want to respect your time. Again, thank you very much for sharing this important conversation with us. Thank you again to Amgen for supporting this conversation, and to our audience for joining us for all 3 parts of our conversation about osteoporosis. Thank you very much, and we give you back your day.
Have a great day. Bye-bye.
Great day.